Bismillah ar-Rahman ar-Rahim. International Ovarian Tumor Analysis, what we call it IOTA. Going back to the risk of malignancy index. As we said, utility is negatively affected in a premenopausal women. Why? Because of two things. An increased rate of false positive and reduced specificities, and is primarily a marker for epithelial ovarian carcinoma, as we said in the previous lecture. Now, the Royal College of OB/GYN give important question. They said, is there another way to estimate accurately the risk of malignancy in premenopausal women without using a CA125? باعتبار CA125 has a high false positive, right, and even false negative. So the answer was there are a simple ultrasound rule derived from the IOTA group. And this system gives a very high sensitivity and specificities, as we will see in this lecture. Now, what is the IOTA modules? The IOTA modules are four systems. The first one of them, and the most important one of them, we call them the simple rule, number one, and it composed of a three stages approach. What does it mean? It means that we will use easy descriptors, and this will give us a clue about the mass, about 46.5%. 10 simple rules, and this will add another 34.1%. And subjective assessment by expert examiners, it will add again 19.3%. So collectively, it will give a very high sensitivity and specificities about the tumor, whether this is benign or malignant, the nature of it. Now, the other IOTA modules are LR1, logistic regression 1, 2, and adenxial modules. These three, or those three, they will use a software installed in the machine, in the ultrasound machines, to give the results. Now, where we use these IOTA modules? We use them to diagnose persistent adenxial masses, whether this is ovarian, whether this is para-ovarian, whether this is a tubal tumor, and are considered to require surgery. So whenever we are dealing with persistent ovarian or adenxial masses, and we said, well, let us do surgery for them because it persists for 2 months, 3 months, we will apply this IOTA modules. Now, IOTA modules, as we said, they are using easy descriptors, 10 simple rules, LR1, LR2, and adenxial modules. Easy descriptors we will speak about, it composed of 6 important points. 4 goes with benign and 2 goes with malignant. 10 simple rules, they are using 10 rules, 5 for benign and 5 more for malignant. And if there is no ultrasound features goes with these 10, we will say this is inconclusive. Or if we have features from benign or malignant, we said this is inconclusive. We have LR1 and LR2. They are, as we said, a software. They incorporate clinical features with ultrasound features to give the results. And lastly, we have an adenxial module, which is again a software system installed in ultrasound machine. We enter, as we see here, we enter the clinical character, we enter ultrasound character, and we enter a CA125, and we will click on calculate, and it will give us a number in no time. Now, this system, what is the importance of it? Number one, it will differentiate between this is benign or malignant. Number two, it will give us even a clue about the histopathology, whether this is epithelial, and if it was epithelial, is it serous, is it mucinous, is it endometrioid, is it clear cells? Now, if it is germ cell tumors, it is whatever. And number three, it will give us even a clue about the grades, whether this is stage 1, this is stage 2, this is stage 3 disease. So this is the importance of adenxial modules. Coming to easy descriptors, we call it ED. What is ED? ED, it means that by ultrasound, there is specific features, goes with specific pathology, as we will see. The first pictures, we will see a unilocular cyst with a typical ground glass appearances. Whenever we see this picture, this is endometrioma. Now, number two, again, there is a unilocular cyst with different echogenicities, as we see in the second picture. We see different echogenicities, and as we see here, something floating, this is the fat of dermoid. If we see it floating, it's what? It again goes with dermoid. And we see acoustic shadowing. What does it mean, acoustic shadowing? A veil. We cannot see beyond it. So this is the acoustic shadowing. And if we see a clear cyst with a uniform or clear underlying surface, this goes with serous cyst adenoma. And if we see a features goes with hemorrhagic cyst. And what are the important features goes with hemorrhagic cyst? If we press by transvaginal ultrasounds, if we press by it by the probe, there will be a jelly, show a jelly movement. If we put a color flow Doppler on it, the mass inside it, the solid components inside it, there will be a no vascularities of it. If we see the margins near the cavity of the cyst, it's a little bit concave. The attachments of the contents with the underlying surface is not intimate. And if we follow this cyst, it will what? It will disappear or it will change with size. These are the 4 main unilocular structures with specific characters of it goes with benign. Now, if we see, whenever we see a mass in postmenopausal women with ascites and a high colored flow Doppler, 3 or 4, we said grades or scores, this again will goes with malignant features. And if we see mass above 50 years of age women with a high CA125 above 100 international, we said this is goes with malignance. So all these features, we said this is ED benign, ED malignant. This is number 1. Coming to the second system, as we said, it's composed of 10 rules. 5 goes with benign and 5 goes with malignant. So the classifications will be B, M, and inconclusive if there is no features goes with each one of them, or if there is a mixed features of both of them. Now, these are the 5 benign and 5 malignants. Now, coming to the benign features, B1 goes with a unilocular cyst. B2 goes with the unilocular cyst again with a solid components, but if we measured it, it is less than the solid components, less than 7 millimeters. B3, if there is, as we see here, there is acoustic shadowing, الظل ما نقدر نشوف بعد الcyst. B4, if there is a smooth underlying surface, is smooth, but it is a multilocular tumor with a قسط size مات على الأقل قياسيا, it will be less than 10 centimeters. And if we put a color flow Doppler in on the tumor, we will see there is no flow or minimal flow inside the tumor, not above it. This is above it. This is not in the scope of the tumors. Inside it, there is no detectable flow. Goes with B5. Now, coming to the malignant features, we have M1. There is irregular. If we see the underlying surface, it is what? It is irregular solid tumors. What does it mean, solid tumors? Whenever we see a mass, more than 80% of its composition is solid, we said this is a solid tumor. M2, if there is ascites, as we see here, there is significant ascites. M3, if there is more than 4 papillary structures. Papillary structures, it is a solid component present inside the cyst. And if we measure them, if it is significant, it should be above, as we said, 7 millimeter. And M4, M5, if we see irregular mass, as we see here, and if we see a multilocular cyst, as we see here, with solid components, and if we put a color flow Doppler to give M5, there will be a color score of 3 or 4. These features all goes with malignance. Coming to the quiz. How is this tumor classified using the simple rule? Is it benign? Is it malignant? Is it inconclusive? As we see here, this is unilocular cyst, clear. We will give it B1. And there is a solid component less than 7 millimeter. So we will give it what? We will give it features B2. So there is B1 and B2 with no other features of malignancy. So what we will say this tumor, this is a benign tumor. Coming to this quiz, how is this tumor classified using the simple rules? Using the simple rules, the 10 rules. If I said simple rules, three system, I will use easy descriptors, I will use subjective, and I will use the 10 rules. If I said only simple rules, so that I will apply a benign and malignant or inconclusive. So is it benign? Is it malignant? Is it inconclusive? And when we describe it, we will say, well, this is, for example, B1, B2, or B1, B2, and M1, M2. It can include two systems. So whenever it includes two systems, it will be inconclusive. So the quiz is how you will describe this tumor according to the according to the simple rules. Thank you.